My name is Rene Arroyo. I live in San Francisco. I actually work in IT, and this is my American healthcare story. I actually was working for a hospital, for a very wealthy hospital, as a contractor doing IT work. It so happened to be that I was actually in the surgery area of the hospital when a nurse saw me, and she looked at me and said, "Oh, you have pink eye." So I diligently went back to talk to the people in my team, and I let them know that one of the nurses thought that I actually had a pink eye, thinking that I would actually get treated and sent to actually see a physician within the hospital. Instead, what actually happened is, as a contractor, they said I would have to go be seen by a doctor of my own selection elsewhere outside of the hospital, that my private healthcare provider would actually have to cover my costs. And I was told that I would actually not be able to see a physician within the hospital because I did not have health care. And they told me that I could not return to work until I actually had a note from my doctor saying that the pink eye had actually disappeared and that I was no longer contagious. At that point, I ended up actually seeing a doctor, having to cover the costs on my own. Of course, I ended up losing about a week and a half, close to 2 weeks worth of wages meanwhile, and this could have all been resolved rather easily. I was working as a contractor at a hospital. They could have actually had me seeing a physician, and within 5 minutes they would have made the diagnosis, they would have written a prescription. It could have been filled within 45 minutes. I could have been treated on the spot, and my recovery would have been that much quicker. But it might have actually not addressed my lost wages as a contractor, but at least it would have addressed my health care. And the problem was, from the hospital's perspective is, well, who is going to cover the cost for these physicians? Well, I asked them, I'm actually doing a service that actually is benefiting, the running and that serves a functional aspect, and all employees' work, serves a purpose, regardless of what that purpose is. And they actually have the professionals in-house, in staff, to be able to actually get this taken care of, and they did not. They failed to do so. And I actually asked to all those viewers, will there be a healthcare plan to help you in your time of need?